I can't think of anything that I'm more passionate about in dentistry than preventing tooth decay. I know that sounds corny, but it's actually fact. I cannot tell you how many times I've counseled patients about what they can do to keep decay down in their own mouth. And as I sat down to do this segment, I realized that in my background is a digital image of actually my dental x-rays. And you notice this big fella here, this big bright one, well, that's what we call a crown. How did I get that crown? I got that crown because in the early 90s, when the Atlanta Braves were doing so well in baseball, we were season ticket holders. My son was a teenager then. He really enjoyed baseball and would go to many of the games during the week at night. And coming home, it was hard for me to stay awake on I-20, so I'd keep a butterscotch in my mouth. Well, guess what? That butterscotch caused that tooth to decay, and I had to have a crown. So as a dentist, we're not immune. A myth now in dentistry is that there's not as much decay because of fluoride in drinking water, etc. Nothing could be further from the truth. We're having an epidemic now of decay, and it's all age groups, kids all the way through up into nursing home patients. And why is this? Well, it's 5 reasons. Sugar in soft drinks, sugar in coffee, sugar in tea, mints, and chewing gum. It's usually one of those 5 things. Now, soft drinks, the problem there is that they're so easy to get now. When I was growing up in Lubbock, Texas years ago, if I ever got my hands on a Coke, it was a big deal. And it was in a small bottle, and I almost felt like I needed to run hide to drink it. Now families keep 32-ounce soft drinks in the refrigerator, and they're just like they used to keep milk. Grocery stores sell soft drinks as a lost leader to get you in the store. They sell it very cheap. Convenience stores sell it in big gulp sizes. Convenience stores, restaurants, you supersize. It's just there's so much of it out there. The really sad thing is I will see kids in their 20s, they've left home, they're on their own economically. Maybe they have dental insurance, maybe they don't, but they got hooked on something like Mountain Dew when they were a teenager. And we have a term for it in the office. We say that their teeth has been Mountain Dewed because they drink so much of the Mountain Dew or the Coke or whatever that their teeth are so decayed, many times we have to have them sent to an oral surgeon to extract many teeth, and these are patients in their 20s. And it's so sad and so preventable. So with soft drinks, you can go to the diet soft drinks, but the acidity or the pH of Diet Coke is 2.7. 7 is normal acidity. 2.7 is a higher acidity than what we use to what we call etch teeth before we bond them. In other words, we want to roughen the surface of teeth before we bond, and it's not that acidic. So the acidity of Diet Coke is an issue, and then you put the sugar with it, and it's really like battery acid on your teeth almost. It's very, very destructive. Sugar in coffee and sugar in tea. Well, what happens now with Starbucks and the other gourmet coffees out there, there's a whole generation of people that are big coffee drinkers, and there's a lot of sugar in many of those drinks, so watch out. What about mints and chewing gum? Well, we've got Altoids, we've got Tic Tacs. People feel like if they're going to be close to other people, they need to pop a breath mint in. There we have it, sugar. So what do we do about those things? Well, with the liquid sugars, the best thing to do if you need the caffeine, and you may need the caffeine, you may work at night, or you may need the boost of the caffeine. Use an artificial sweetener with either tea or coffee, something like Splenda, and make your own tea or coffee, or if it's available wherever you buy your coffee, use the artificial sweetener. I would just eliminate soft drinks except at mealtime. Soft drinks at mealtime are no problem. The problem is when you keep one there where you work and are always sipping on it. What about mints or chewing gum? Go sugarless. That's the key. And what if you're a parent influencing your children? My daughter is a physician, Thank goodness I've never had to talk to her about her children, which of course are my grandchildren. My grandchildren never, their ages, they're young, they never get a soft drink at a restaurant or at home. They do get soft drinks when they go to birthday parties, but they get either milk or water, and that's really the way you should go. What about juices for children? Juices are natural, but they're high in sugar. Remember, just because it's natural doesn't mean it's good for you. Heroin is natural. So if you're a parent and still influence your children, keep their soft drinks down, keep their juices down, use more water, use more milk. It's just so sad to have to work on kids that have so much decay that they have to be put to sleep. We have to refer them to a pediatric dentist. And it's so sad to see nursing home patients that come in because well-intended relatives leave them with a little bowl of candy. So we see it from the young, we see it to the old, we see it in between. It really is an epidemic, and it's something that we can do something about.